Thank God for all women research teams because this paper finally highlights the issues that women with ADHD experience in real life. For decades, ADHD has been treated as a very male-centric disease. Part of the reason why ADHD gets diagnosed so frequently in boys is because the symptoms are looked for and more commonly associated with boys, specifically hyperactive symptoms. Women are more likely to get diagnosed with anxiety or depression before receiving an ADHD diagnosis. Women are more likely to have internalizing symptoms, and they're more likely to mask effectively. And masking actually works really well for a lot of women until something like perimenopause or postpartum state comes along, where we experience massive drops in our estrogen levels. And estrogen has been shown to be linked to ADHD symptoms. This is why a lot of women require, for example, medication dose changes later in their cycle, aka the luteal phase, because this is when estrogen begins to decline and it can make our ADHD symptoms worse. If this sounds like you, talk to your doctor about it and see what they can do. As estrogen affects things like dopamine, norepinephrine, and serotonin, this makes sense why so many of our symptoms are contingent on having estrogen around and improve during the follicular phase or the first half of our cycles. The paper actually demonstrates how in certain animal studies, they showed how estrogen was actually affecting neuron formation and synapse formation, and estrogen was involved in helping neurons communicate more clearly in animal models. Estrogen is essential for brain function. For example, there are studies that show that after women have radical hysterectomies, they'll experience a perceived cognitive decline in the months following that procedure. Because the issue is the rapid change in estrogen, not just losing it long term, but the fact that we have this precipitous drop, there can be other amazing therapies, like, for example, hormone replacement therapy, that can also help women as they're going through these changes in life. As we learn more about this and become more empowered, we can actually treat it better. So talk to your doctor about all of these options. If any of this sounds interesting to you, follow my channel if you like learning more about your hormones and your neurodivergent brain. Comment systems if you want to learn more about working with me, because I help high achieving adults create systems that will last a lifetime to manage their ADHD.